I am familiar with kids having ADHD, but adults ADHD, is that even a thing?
ADHD, or attention deficit hyperactivity disorder as we know it, is actually a neurodevelopmental condition. What it means is that a part of the brain is either underdeveloped or it's developing at a completely different pace. Now, as children grow, the development catches up and they don't show any signs once they are older into their adulthood. But in some cases, this gap remains. And it is when adults also show signs of inattention, the ADHD signs. So yes, adult ADHD is a real condition. So when as an adult you wonder that why am I struggling to manage my time better, why am I constantly disorganized, why am I starting a thing, not finishing it, moving on to the other things, impulsive, recklessness, this is when you should go get yourself evaluated for ADHD. The most common signs would be inability to sustain attention, restlessness, sometimes even recklessness, impulsivity, lack of focus. Forgetfulness is also very common, and in some cases you will see hyperfocus in adults as well. You know, honestly, that said, it doesn't mean that the symptoms or the signs work against you. Take for example hyperfocus. It can allow you to get things done in detail, right? And it's especially important for tasks where attention to detail is very important. However, it's also very important to note that these signs like inattention, it's only a disorder if it is impacting your day-to-day functioning. You are experiencing distress as a result of the severity of these symptoms, and it is persisted over a period of time. One day if you are inattentive, that doesn't necessarily mean you have ADHD. The evidence needs to be present through your childhood.
Now that we've talked about symptoms at length, the good news is that ADHD is manageable.
That is correct. ADHD is very manageable once the diagnosis is made correctly, and with proper professional guidance, it can significantly improve the quality of life. A usually good starting point is behavioral therapy, BT as we commonly refer to it as. You will learn to manage your routine, your activity levels will improve, you will learn tools to manage yourself, your time better, thereby being more productive, more efficient, and improving the quality of your life. Other forms of therapy that work well are CBT, cognitive behavior therapy, which will allow you to learn how to challenge some of your negative thinking styles about yourself, about your condition. Sometimes social skills intervention, where you are imparted with skills as to how to navigate an interpersonal or a social situation, also improves your efficiency, therefore improving the quality of your life. So quality care can actually allow you to enhance your functioning and allow you to make the more benefits out of your strengths. For example, if someone who has hyperfocus and if the right kind of support is available to them, this can actually work out in their favor because they will learn tools and resources to distribute that adequately. So in a sense, what I'm trying to say is that proper professional guidance will help you with your condition better.
When it comes to risk, misdiagnosis, medication, do they come into the picture at all with ADHD?
Yes. The biggest risk with ADHD is not realizing your full potential and the emotional dysregulation that comes with it. It allows us to also be exposed to other risks like depression, anxiety, and all of this can take a toll on your mental health. So proper care, as we discussed, is important. Once the diagnosis is made, the quality of life improves with therapy and treatment, and only in very severe cases medications are given by the psychiatrist. It's either a stimulant or a non-stimulant. So in a nutshell, if I were to summarize or talk about it, it is correct diagnosis and access to good quality mental health care that will allow you to manage your condition better.
With so much misinformation being out there, especially in the presence of social media, navigating mental health information can be particularly overwhelming because it's also difficult to vet and understand the source of information. How does one really go about this?
You know, when we look at the information that is readily available on the internet, on social media, the information often is unverified, may not always come from credible sources, and individuals who talk about their experiences, pretty valid for them, but their experiences may not always work for you. And you know, sometimes internet can also be a dark place. So when you're looking for something, you're going to find it. So it leads to confirmation bias and a lot of misdiagnosis and self-diagnosis, which isn't very healthy. So when you're actually ready to seek help for your mental health, it's important to ask a few questions to your therapist or psychiatrist or whoever you're going to. First and foremost, it's very important to check for their qualification. Especially for psychologists or therapists, you must look for someone who has done a minimum of MA, Masters in psychology, either clinical or counseling. And then there is MPhil in clinical psychology. So you have looked out for the qualification from a recognized, reputable institute. Second, based on your preference, you can also ask for years of experience. Look for their body of work. Do they have expertise in working with difficulties that you are experiencing? So you can tell them briefly about whatever you are struggling with and ask them if they have experience, what is the school of psychology they follow. It's very important that the work they do is evidence-based, which is backed by scientific evidence. There are documented papers about it. It's just not common sense. And it's not pop psychology as we are seeing very often these days. And more importantly, they should be willing to have an open dialogue about you, whoever you go to.